At least 17 people have died in the coronavirus outbreak in China. The virus first appeared in Wuhan last month and is spreading. Hong Kong has confirmed its first case, and the virus has also reached the United States. Let's get the very latest now and cross to our correspondent in LA, Danielle Robertson. Danielle, so as I was saying there, the first confirmed case in the United States where you are, what more do we know about who this person is and how they took ill?
Yeah, the first case was confirmed in the United States on Tuesday, and this was a male patient in his 30s. This coronavirus originated from the city of Wuhan in China, and this male patient was in Wuhan and he had travelled back home. He is a US local to Washington State, which is in the northwest corner of the United States. Now, he arrived here without having any symptoms, and it was only until a couple days later that he started to feel a few of these symptoms: cold, fever, runny nose, and he saw the news of this coronavirus outbreak and he presented himself to health authorities. Now, he arrived in the United States before screenings were implemented across the country. So he wasn't faced with these screenings when he arrived here. He is now in isolation, and health authorities are meticulously looking through his exact steps that led up to this point and anyone else that he may have come in contact with. He's now in isolation in Washington State. He's being monitored very closely. But you could imagine this first case that arrived in the United States did spark alarm across the country, and there has been increased screenings at some of the main airports, including Los Angeles, New York and San Francisco. That has now been increased to Chicago and Atlanta.
That brings us to the question then, Danielle, of possible contagion and how it'll be managed beyond airports. What is the level of worry currently among United States authorities about a possible spread?
Yeah, so United States authorities are trying to do everything that they possibly can to stop this outbreak from entering the country even further, from stopping people from coming here with the coronavirus. And what they're doing is they're increasing these screenings, particularly at some of those airports, and that started this week. Now, what that involves is everyone who is arriving here from China, from Wuhan specifically, will be asked questions where exactly they have been, and then they will be screened for symptoms such as fever, flu and pneumonia. If they do present with any of these symptoms, they will be taken away for further testing and examination. But of course, these screenings are not foolproof. And the case of this man who arrived in Washington State is a perfect example of this. He arrived here without any symptoms and he developed them later. So it isn't a foolproof screen testing, but it is something that they are doing to try and ramp up to stop the spread of this coronavirus in the United States. But there is a concern that this could become a global epidemic. So far, it has already killed about 17 people and sickened hundreds, and it's now spread across 4 countries.
Final question then, Danielle. Is there a great deal of information available just outside of the media to Americans just so that they are clear and there's no misunderstanding about the virus and its possible spread?
Yes, so how it is spread, I think that was your question, so it was a little bit hard to hear there. So this is sort of a new strain of the virus. So basically, it began in Wuhan, China, and they believe it was from a food market where there were live animals. And this new strain of the virus, health authorities have confirmed, is transmitted from human to human. Now, little is known about this new strain and how infectious it is, how easily it can be caught, and there isn't a vaccine for this new strain. So that does make it a little bit difficult to assess just how worrying this is and if it could become a global epidemic. The main way that you can prevent yourself from getting this infection is from direct contact from people who are infected. So that includes things like sneezing and coughing and droplets from sneezes. That's the direct way that you can contract this virus. We know that 15 health officials have already been diagnosed with this virus, and they have obviously been working closely with those people who have been confirmed with these cases. And now health officials and anyone who is dealing directly with any of these patients have to wear a full bodysuit to ensure that they do not catch this virus. And people across China are now starting to wear face masks in a bid to try and prevent contracting this disease. But as I said, it is a very new strain. Little is known exactly how contagious this is, and we're learning more as the days go by.
Daniel Robertson, I beg your pardon, my thanks to you. She's our correspondent in the United States, speaking to us about the coronavirus. Time now for